you had a great 4th of July, whether you were out having fun and adventuring, or if you were working. Hopefully there weren't too many ER accidents or anything like that. So I hope you guys all had a wonderful 4th of July. We're happy to be back with another virtual event. I know most of you are facing a lot of burnout, even with, maybe having fun at 4th of July. You're facing that burnout, fatigue, and a changing market, among other things. So COVID's impact has put pressure on a very passion-driven and patient care-focused industry, which is why mental wellness is the most important than ever right now. So the VP of Clinical, Jill Eliassen, and John McClellan, who has 32 years in the healthcare system, wants to talk about it and spark the conversation so you don't feel so alone, because trust me, you are not alone. They want to share the resources that are out there and want you to know, want to know what you're facing. So feel free to put that in the comments, say what you're feeling. And if there's anything that you want to ask them but don't feel comfortable posting in the comments, please message the Gypsy Nurse fan page or the TNAA fan page, or if you have any contacts at TNAA, reach out to them with your questions. We'll be all happy to help with that, but don't feel like you're alone. We can do anything anonymous. So let me bring on Jill and John so we can get started. Hi guys, thank you so much for coming on.
Hi, Rachel.
Hello.
Oh, yeah, it's such an important topic, especially now. So I appreciate you guys coming on.
Yep, thanks for the good intro. We appreciate it.
Yeah, you're welcome.
Awesome. So John and I work together at Travel Nurse Across America. I'll just share a little bit deeper background about myself. I've been a registered nurse for 23 years. I've been in healthcare staffing for the last 12 or so, working on this side of the healthcare staffing industry, which has been an amazing experience. John, maybe you want to take a little deeper dive into your background, just so everyone's aware of our experiences here today.
Sure. Thank you, Jill. 32 years in healthcare, acute care settings, even in the clinical, clinic part of it as well. And that's one thing we notice as I would do benefits for the last probably 25 years of that. The connection that you have to make with nurses and employees on their benefits, they don't even realize what their benefits can do for them. And there's a lot that are just free. You don't even have to have the health insurance for some of those that are just given to the employer. So
yeah, I love to hear that, because we as nurses, we're really busy and we're really task oriented, and we're kind of busybodies. And so when you ask us about, well, your benefits, and it's like, what? I really don't know. So we're here today to maybe make that a little bit easier for all of the travelers on Gypsy. And I just want to say to the Gypsy population out there, we love to hear from you. I love to see your texts. While some of them very heartfelt, some of them are really, they're real. And we just enjoy seeing the real that you put into healthcare today. So first off, I want to say the first 5 Gypsies to interact with us, ask a question, give a comment, we're giving away backpacks. So you want a good, awesome TNAA backpack to have on your travels out there. So definitely comment, ask us some questions. Secondly, I just want to give a fast background about the clinical support that is offered at Travel Nurse Across America. While it's not just my department that offers massive amounts of supports. John works in the HR department. They offer huge support. Every department at our agency offers support, but I think it's important to talk about the clinical team that I have working with me at Travel Nurse Across America. Together, we equal 135 years of nursing experience. We've worked on 35 different specialty units, and the most wonderful part about this clinical team is the fact that half of them still work at the bedside. So we absolutely 100% understand what has happened to our industry in these last 15 to 17 months. This pandemic has flipped it upside down. Our nurses and travelers in the hospitals, not just nurses, it's everybody, are experiencing just incredibly different workflows, and the anxiety and the stress that comes along with it is just unprecedented right now. So we really want to hear from you. We want to understand what the challenges are for you a little bit, while at the same time, we're going to have John take a little bit of a deep dive into some of those benefits that we forget that we even have. As John alluded to a little bit earlier, you might have an insurance plan that has a lot of things to offer. You might have a no insurance plan, but there are still a ton of things out there that you can take advantage of. And I just think it's really important to dive into some of these and touch base with some of what there is to offer. So John, maybe I'll bounce it back to you, and you could share your top 2 or 3 favorite things that are out there right now that folks should be taking advantage of.
Absolutely. I think one of the most important programs that we offer, and this is whether you have health insurance with us or not, or maybe looking at a different agency, is an employee assistance program. And you may have heard that word before. We call it EAP for short, but they offer solutions for work-life balance, legal guidance, financial resources, online support. Unfortunately, that's one of those things that it comes at the last minute, and you're thinking of that. I have benefits. I'm thinking health insurance. This is something that's an employee assistance program. You can call them 24/7, 365 at a number. They can call you back shortly, or if not, you'll get a trained triage counselor on the phone to find out what the problem is, go through the steps to get you some help and resources. Another program that we offer is, which is new to me, is a chaplain assistance program, which is, again, also available 24/7, 365. And that's somebody, if you want to do a more personalized one-on-one, we have an actual person, Angela. She's great. She just, our other person retired. We've got a new chaplain with us, and it's a Corporate Chaplain of America program. We're assigned to Angela. She comes on site once a week. She can also, or is available to travelers as well, just by going through a website and or text. And she usually can call back within 15 to 20 minutes, find out again, triage what the situation is, maybe just need to chat, and it couldn't be just for your needs. It may be you have a spouse going through something, or a teenage child, or just need to talk to somebody. It's a great resource.
Those are great ones. And I just am going to jump back to the EAP a little bit. You just mentioned it. It's not always for us. Sometimes it's someone in our family who may need assistance. And I'll be open and share. I have a 16-year-old daughter. She didn't love being an online school student this last few months of her sophomore year in high school. And so through EAP, I thought, I'm just going to check on this and see what even is this, because I hadn't had to utilize it before. And it was the easiest program and the easiest process. Within a few minutes, we had a call back from someone who was local in our local town who was going to meet with her via Zoom. She had 6 sessions, which was unbelievable. So many things that you can do with your benefits that you just don't realize. So I like to share my own personal experience with it. It was very good, and it was very simple to use. So we've got our first comment. It comes from Kat, and her comment is hitting my heart close, and it just says, so many are leaving. I know. Nurse burnout is a real thing throughout this pandemic. It's not something that any of us ever thought we would see. Think about nursing prior to this pandemic, and we were all pushing at the federal level for better nurse to patient care ratios because they were bad before the pandemic. And look at what has happened throughout this pandemic. And now our ICU nurses are taking 3 patients, 4 patients in the ICU. Sometimes they're not acting as an ICU nurse. They're having to float to other units where they're not necessarily comfortable. ICU nurses taking 6 or 7 med-surg patients isn't something that they just really are used to or can do. The burnout is real. Many of you gypsies out there have worked 60 hours a week for how many weeks in a row? There's a lot of data, and I don't want to get too much into the data, but prior to the pandemic, 1 out of every 3 nurses was leaving the bedside by the 2nd year. And there's a lot of new data showing that it's even more serious than that right now. So what can we do to help our industry? Our industry is in a crisis, and we're here to just share a lot of the important things that you can do to decompress for yourself, take time for yourself. One of the gypsies on Gypsy, and I stay on Gypsy very closely because I just love to see what the nurses are doing. She said it best, and she said, nurses have got to learn how to do nothing. So on your day off, you just got to learn how to do nothing. And that's hard for us nurses because we're really task oriented. We're really busy bodies and we don't like to sit still. So Kat Carnes, thank you for your comments. You're going to get one of our free TNAA backpacks. Steve says, thank you for doing this. It's a very important topic. Mental wellness is a real thing. And I think it's just really come to the surface throughout the pandemic, which is fantastic. So John, you mentioned a couple of things that you had to mention. Maybe you want to dive into a little bit about what someone does who has a Cigna plan, or what someone does if they have a specific insurance plan, what kind of opportunities they have.
Right. And I want to also point out that there was a story posted on the website on Stanton Henson. He's one of our travelers and ambassadors. It's a really nice story to read. And, he made a comment. It's like, nurses always put their head down. They're running toward the fire to get through it. Now's the time to look up. You do have resources available to you, and the resources that we provide, or any employer should provide, should restore to you the joy of nursing. That's the whole key. One of our other topics is the what we call a concierge service through Health Advocate. It's got things for medical care, administrative issues. Say you're new in a town. I'm a traveler and I'm going to a town I've never been to. I'm always going toward that adventure, and I need help. I need a specialty doctor, or hey, I need help finding. And where's the dry cleaners? Where's good places to eat? It's a concierge service, mainly focused toward the health related things, but they can. We had one person that called and was like, I need help planning. I'm new in town. I got my family with me and I want to help planning a birthday party. Can you help me? Is there Chuck E. Cheese's around? Is there places like this? I was thinking that's not really health, but they took care of it. And it was was a nice story. So
that's a great story, and that helped that person get together with friends, have a great time, laugh. Right. We could talk about laughter in a little bit, and what it does to your immune system is unbelievable. So we have another comment, Mackenzie Murphy. Thank you, with a big ol' heart. Thank you. As a travel nurse, it has truly taken a big toll on my mental health and my passion for the profession. And I think you, Mackenzie, along with all the other gypsies, feel the same way. I went to nursing school so I could have that caring human touch on people. I wanted to be around people and my patients. And over the years, that has been slowly taken away from us nurses. There's no time to be with your people because of the technology requirements, the documentation that you have to do, the things you have to keep up with for the HCAPs on your unit. I could go on and on and on. And I know you guys are you're exhausted because you got to get the whiteboard up in your room. I mean, let's be real. Those kinds of things take away from your hand holding a patient, talking to a patient, listening to a patient, helping your patient has really been pulled away from our travelers. And we just want to get that back to all of the nursing community for sure. So then Kat, you're talking with Mackenzie. Mackenzie, I'm a travel RN also, and have been working COVID since I headed to New York. I'm burned out and exhausted. And Kat, you are our hero. You guys are our heroes. Yeah. Going to New York when COVID just started really leaves, it just gave me goosebumps all over my body, but it just leaves you guys with such a different view of what this pandemic did to our country and what it did to New York City especially. So I can't say enough for any of the nurses who dropped everything. You left your family, you left your friends, you went to New York City, you went to some of these hot spots, and you worked 60-hour plus work weeks for a long time. All you could do is go back to your housing, your hotel, wherever you were, sleep, get up, and go repeat the same thing. And as we're talking about this kind of thing, it's not just the patient care that has changed so much, but you all also dealt with a lot of death and a lot of dying. And we nurses are prepared for that. We've never been prepared for that to happen 4 times on our shift, 5 times on our shift. And that is just something that really took a toll on us as nurses. So Kat, I hope you're doing some wellness for yourself. I hope you're taking some time for yourself. It's important to just spend time with your friends and your family and to take advantage of some of these opportunities that are out here. And John will mention a few more here soon. And I see you that you weren't prepared at all. Your comment that you weren't prepared at all. I don't know that there were any nurses or healthcare professionals that were prepared for what they had to deal with out there. And then it was just the changes, Kat, and I'm sure you'd agree with me on that one too. The treatment changes and the different things that would switch from shift to shift to shift were just really hard to keep up with for nurses as well. So thanks for your comments, Mackenzie and Kat. You both have backpacks coming towards you. We need some more comments and interaction. So come on, Gypsies, come share with us your stories. We want to hear your stories and what you've endured throughout this pandemic. And then what are you doing now? So Kat, I don't know if you're working in a hospital right now, but I'd love to know where you're at. Same with you, Mackenzie. So John, anyone who maybe doesn't have the benefit, or you pick what else is great out there?
Yeah, there's
for these guys.
When you're related to the health insurance benefits and even outside the benefits, there's programs like Talkspace. Some of these are video led, one-on-one. I think that word's been around a little bit. Maru Health has flexible therapy programs. They week 1 week at a time, different videos that you can look and view and kind of get your library built up. There's also Prevail. There's also Cigna Life, our health insurance. I think most health insurance is Blue Cross Blue Shield has virtual programs that you can attend. They have one coming up on September 21st. Look at that coming up. It's Thinking Through Uncertainty, which is a really good one. I've seen a couple of theirs. Very well presented, very quick, very short, to the point, to kind of get you the resources that you need.
I like those. And John, as nurses, sometimes we don't want to sit down and take the time to do something like that. But I think right now more than ever, it's most important to do that, to give yourself a half an hour and watch a live cast or watch a presentation about what is out there and what you can do to help yourself. I've never been so intrigued to hear the emotional support that can come from some really valued speakers in the industry, for sure. So I'm glad you brought that up, John. We have another comment. This comes from Ryan. Very important topics to cover for nurses. 100% agree, Ryan. Thank you for your comment. Would love to know your specialty. Would love to know where you're working. But you have a TNAA backpack coming your way for being our third person to come comment to us. So thank you for that. Steve Curtin says, I am concerned for the nursing community relative to the Delta variant making inroads into the U.S. I fear that many nurses who need a break will be called back into action, unfortunately. And I share that same fear with you, Steve. And I know that John does as well as everyone in our company and in all staffing agencies and in all the hospitals across the country. It is, there's a crisis right now when it comes to nurses and staffing, and it's really scary because those who are at the bedside day by day need help. I mean, all of you gypsies out there right now, tell me when the last time was that you worked with the CNA at your bedside. Our CNAs are getting pulled away from us. Our resources are being pulled away from us because they have to go help in other urgent situations where there could be a mental health hold. There could be, just a patient who needs a sitter in the room, or someone who needs they need a body in the room to watch a patient. And so when our nurses are working these hard shifts already, and we could have another influx of this variant, we as nurses all know it's a virus. Viruses thrive to live. They go from host to host. So when it's done its job in one host, that is you, John, then it's going to jump over to me because I'm its next host. It's what it does. And all you pediatric nurses out there, how are you? What is going on with RSV in the middle of July? It's summer. We're not used to seeing these viruses peek and rear their ugly heads in the middle of summer. And so pediatric units, PICUs, pediatric ERs are on divert in Texas and in other countries. Well, they are in probably other countries too, but I meant counties and other states in the United States. It's a real crisis. And so, yes, Steve, we all have a fear about what's going to happen in the fall. Is the flu going to come back and rear its ugly head? It was a little suppressed throughout all this COVID, and a high level virus can do that to another virus. It can kind of suppress it because it won the contest to be the host from body to body. But now RSV is starting to come back, and there will be a bit of a war between our viruses, and unfortunately we are at the forefront to try to combat that. Can't say enough about vaccinations. I know everyone's different on their choice, and that's okay too. These viruses are still going to win regardless. So it will be interesting to see what the flu will do in the fall. We talked about that a little bit internally within our company today at TNAA. But to all of you nurses out there, you've got to rest. You've got to take time for yourself. You've got to take advantage of these programs that John keeps piping in about. We've got the text at the bottom of the screen that continuously runs across. That's a crisis text line for anybody. If your shift was that rough and you can't find the right person to talk to, text 741-741 and you'll have someone right there, and I don't think you'd regret it. We are here to listen. My clinical team listens to calls from nurses every day, every minute, every second. Our recruiters listen to calls every day, every minute, every second. We want you to call us and share your stories and share your fears. John works in the HR department. Our support over on that side of the house in our agency and in any other agency is very, very on point, and we're here to help and listen. So a couple more comments. Leanne, thank you so much for this. She sent us our little prayer hands. We love that. I hope you're listening. I hope you're taking care of yourself, Leanne. But you're the fourth person to get a backpack, so fill that thing up with goodies and go out for a walk. I don't know what everyone likes to do for their own decompress. I personally, once a week, I get together with girlfriends. And here's why. I learned something about laughter. Laughter is one of the best it produces T cells in your body. Those cells are your immune response. It's good for you. It's happy. So when you get out with folks that make you really happy, you can take a deep breath. You can talk about things outside of nursing, or sometimes you go with your nurse friends. And there's nothing more fun than a bunch of nurse friends getting together and going out. That's for sure. And just sharing your stories. Storytelling is therapeutic. And when you're hearing that you're not the only person going through this, it feels better. Ryan is a dialysis nurse and had 4 days to pack my things and come to Guam. I left everything, and I have been there for almost 11 months with limited resources, working 48 to 60 hours a week. I'm burned out. Ryan, wow. Dialysis is huge. That is a big job. Your patients are critical. Let's talk about how critical patients are today. They're more complex than they've ever been before. Considering leaving my nursing profession after this, I hate to hear that, Ryan, but I understand it, and you're not alone. And a lot of nurses are finding other things that they can do, either number one, with their nursing education, or number two, leaving altogether. I have a good nurse friend she was a nurse for a long time. Now she's a full-time bartender. Okay, that's what she felt her calling was next, but she put in 20 years at the bedside, and that's what she decided to go do. Thank you for your comments, Ryan. We love everything you've done, and you've got to take care of you, and you've got to decide what it is that you want to do. So, John, what else do you got in your back pocket over there that could be really beneficial for some nurse who's, they've just had enough, and they've really, or maybe they need just a one-time fix? What's some of the coolest things that they can utilize when it comes to a benefit?
I kind of want to focus on, we have several benefit specialists that do work with the travelers on a daily basis. There are situations that, we speak benefits in HR, and nurses speak nurse, and a lot of times we have to interpret that. They may be not getting the result they're looking for with their health insurance or things like that. We can be their advocate, and are their advocate a lot of times when they come in, they have an issue. We do that quite a lot. Something would come in pharmacy related, or something's not covered, and we are their advocate to go to the insurance company and to go to whoever and go, what can we change? Is it something that we can fix and change and move and do a different way? We're really big advocates on that to try to get the nurses back where they need to be and resources that they need.
Love that. And I'm so glad you gave a shout out. Those benefit specialists, they don't, I love how you say that. They don't talk nurse, but we talk benefits. I mean, it's so true. Nurses talk nurse. We nurses, we go back and forth. We love to hear from the benefits specialists and understand everything that we actually have available to us, because we just forget. You brought up Stanton Hinson and the blog that was done and what was done with him. And he mentions that too. You know, you got to take a time out and see what's out there for you. And that's really something that we nurses have never had to do prior to this pandemic. I mean, we have here and there, but it wasn't near as extensive as it is right now. So I love that comment, and our benefits specialists are just amazing. Kathy, love going out with you. Jill, thank you so much. We love you too. We still have one more backpack to give away, so come on, nurses, come talk to us. We want to know where you're at, where you're working, what's been your biggest obstacles. We're just here to listen. I really love to hear what everyone's doing. I love hearing about dialysis and being in Guam. I know our ICU nurses are exhausted. I know our med-surg nurses are exhausted. Already gave a little shout out to our peds nurses. How about the ER? Okay, I have a real life story from this last weekend. I was in the hospitals over the weekend and was talking to one of the directors, and we had 52 patients in the ER waiting for beds.
Wow.
How are you doing, ER nurses? Tourism is on the rise. Accidents are on the rise. You in triage are running ragged down there. Some of y'all are still taking your patient assignments in the hallways because we know there's no beds for your patients. One hospital system had 112 patients waiting for patient rooms up on the med-surg units, tele units, things like that. So how are our ER nurses doing? I would love to hear from an ER nurse to share a couple of stories. I have a couple of ER nurses on my team, and they share stories with us all the time. And it is hectic and busy right now out there. A lot of folks within the last 15 to 17 months, John, you know this, you guys know this in benefits, they put off their care for a while.
Mm-hmm.
So our patients are sicker than they've ever been in these hospitals, and they're more complex than they've ever been. And that just makes it that much more difficult for our travelers to care for them, especially with lack of resources. So another interesting statistic, everyone, remember when the ORs stopped doing elective surgeries? There are over 1 million people on the OR wait list to get surgery now because they put off that hip for too long. They put off that knee for too long. And so our orthopedic nurses, huge shout out to you. Y'all are going to be busy for a while. It's just tenfold what is going on. So something else that could be your favorite, John? Do you have any other items up your sleeve that you would recommend for someone who's exhausted today?
Yeah, there is, I always like to hear from nurses. It's this time of year we start planning for benefits open enrollment.
Benefits planning.
Benefits
Yes.
planning, I always got to do it. And it's always nice to hear, what's out there. Maybe we're missing something. Being a contingent staffing agency, you're looking at, you're having a few benefits. We have the full gamut. We have health and dental and vision and life and disability and even optional benefits, even pet insurance for our fur babies.
Yeah.
But
nurses have their fur babies.
Yes. Travel with their fur babies. Yeah.
Yes.
But that's in addition to all the basic insurance, what I call core insurance. We've got the chaplain program, the EAP, things through Cigna, Maru Health, Talkspace, things like that's accessible. But I mean, we've put out there to our carriers, what's trending, what's coming up. Is there something new, something better, a quicker resource for our nurses or travelers? And we're getting some feedback. But if anybody has feedback here on something that's out there that's of interest, that they've worked with another agency, we'd like to hear about it too.
Yeah, definitely. Another comment out here, John. This is from the Gypsy Nurse. Megan from Instagram is worried that if she seeks help from HR, that her agency or hospital will find out and she won't be considered for another assignment or lose her assignment. So how can we help Megan from feeling that way?
Yeah, anytime you talk to human resources, it's very confidential. We share it with nobody, no agency. It's like a client privilege opportunity. You don't talk about it among anybody because it's private, and a lot of that includes PII, PHI. It's between us and the individual.
Love that. And I think that's a great thing to bring up and a great thing to mention. So I'm glad that the Gypsy brought that up to us. Mm-hmm. It's scary to come forward sometimes. You don't want to think about backlash. You don't want to think about, constantly looking over your shoulder. Who knows what about me? If you go to an HR department, that is a confidential visit. Mm-hmm. So don't be afraid to reach out. Your agency will not hold that against you. Right. And your HR department will keep that confidential 100%. Mm-hmm. Yep. Good. I think a couple of other things that stuck out to me. Definitely, if you're interested to see what kind of benefits TNAA has, just go to tnaa.com/benefits. You'll see a lot of things on that page. And for those of you gypsies who do travel with TNAA, it doesn't hurt to pay a visit back to our website to remind yourself what is offered. And for any of you who aren't with TNAA currently and with a different agency, do the same. Go to your agency's website and find out what benefits are available to you to utilize. It's just more important now than ever. Any other thoughts, John?
Yeah, on that same vein, it's a great point. When you scroll down to the bottom of our website and click on Explain My Benefits, there is a fantastic resource that has all the information I've been talking about. You have a clickable resource that can print off a white paper, lots of information on there explains, and our benefits are pretty transparent. They talk about the actual premiums that you would pay, things like that, so you can compare your benefits. I recently have a comparison Excel spreadsheet for the specialist to use. That's like, well, maybe this is the health insurance is going to be one of the biggest priciest items concerning traveling with an agency. You can compare our insurance. You can get with a specialist. Hey, this is what I'm currently doing for the different, how much it costs to see a PCP, a specialist, things like that. You can do a comparative on there just to find out, is it worth it?
Yeah, that's excellent advice, because that is probably one of the biggest obstacles when you're looking at taking an assignment, or you're new to travel and you don't know where to go. Mm-hmm. Benefits can be a really deal breaker sometimes. Mm-hmm. Mm-hmm. So really researching that and studying that from agency to agency is absolutely worth your time. So I'm glad you mentioned that, John. I think we'll pull Rachel back in. I can't think of anything else that we need to mention to our gypsies today, but it's been fantastic hearing from the ones that we heard from. Mm-hmm. And I know that John and I got out all the great information that we really wanted to share with everyone. There's one more comment. And Ron, you're our 5th guy to get a backpack. So thank you for your comment. Such a needed discussion. And we 100% agree. And we want to come back. And we definitely want to hear more from all of our gypsies out there. So thank you.
Yeah. And definitely, just keep talking about it, even with your coworkers, even saying like, oh, I had a bad day. And you're just opening that conversation. We had someone back in June, and she said that she actually lost her husband to suicide, and he wasn't a nurse or anything. But she said, just talk to them, go up to people. And if you see that someone's acting a little bit differently, go up to them and even say, hey, maybe go talk to HR, or, anything like that. Is just get it out.
It's okay. Stanton Henson's blog, it's okay to not be okay.
Yep.
Just don't forget that. I love that. Thanks, everyone. Naressa, thank you. Claudia, thank you. We love you too. Thank